Well, when lawmakers return to St. Paul at the end of the month, they'll start working on many issues involving our criminal justice system. One of those is a problem 5 Investigates first told you about last year. Minnesotans with mental illness are falling into a gap. They can't be held accountable, but they also can't get the treatment they need. Tonight, we're getting an exclusive first look at how lawmakers plan to fix this complicated problem. I sat down with the Democrat and the Republican who are trying to help the lost souls.
Mental health advocates, public defenders, prosecutors, even judges all agree there's a gap in the criminal justice system in Minnesota. Hundreds of people every year are charged with a crime, but are found incompetent to stand trial due to a mental illness. They're not sick enough to be court-ordered into treatment. They either sit in jail until they're competent or they're released into the community.
It's a lot of lost souls. A lot of people who are just out there and are probably going to have the same thing happen over and over and over again.
5 Investigates first reported on those lost souls last year after a deadly shooting at a health clinic in Buffalo showed how dangerous the gap in the system can be.
We always wait until it's a crisis.
And after years of debating how to fix the problem, mental health advocates and lawmakers believe they found a compromise that could make a difference.
The easy conversations are over. Now we're getting to the uncomfortable part.
It's a complicated, weave that we're trying to figure out. How do we help people and also protect public safety?
Heather Edelson, a Democrat, and Tony Albright, a Republican, are finalizing a bill that they say will help close the gap.
These are recommendations of everyone that works in this field, from judges to prosecutors to mental health clinicians.
Edelson, the chief author, says the bill gives judges the authority to order a defendant into treatment. It directs community-based programs to provide competency restoration, a service someone can only get right now at a secure facility run by the state. And finally, the bill creates a forensic navigator position, a person who will follow the defendant through the court process, like a caseworker.
We are actually making sure in a more assertive way that the person is connecting to the very services that they need to do well in the community.
Mental health advocates like Sue Abderholden helped write the legislation.
Largely what we're seeing is people who are doing nonviolent crimes, nuisance crimes, who are doing them over and over and over again, and who are frankly just lost in our system.
Abderholden says early intervention could help prevent the worst case scenario, like what happened in Buffalo last year. Police say on February 9th, Gregory Ulrich opened fire inside the Allina Health Clinic, killing 1 and injuring 4 others. Ulrich had previously been released back into the community without any court-ordered supervision or treatment, despite repeated concerns over his mental stability and a court ruling that found him incompetent to stand trial in a previous case.
Why are we waiting until it gets to that point?
Not every single person that is struggling in this gap case is a violent person.
We're really dealing with the ones that are in the shadows of life. And those are the ones that, candidly, the state needs to worry the most about.
It's no secret that a major overhaul of multiple institutions in Minnesota will cost millions upon millions of dollars over multiple years going forward. How do you make that pitch to your colleagues here in the People's House?
Let's not dance around the subject. It's going to be a very large investment of state resources. But what's the outcome if we do, and what's the outcome if we don't?
I think that we have a huge duty to intervene, and our job. That's why we're elected.
Edelson says without these solutions, she fears the revolving door will continue trapping people like Jude O'Neill. Arrested and charged more than a dozen times in Minnesota for low-level crimes, 5 Investigates found O'Neill's competency came into question in nearly half of his cases. His mother told me last year she's tried to advocate for her son with little success.
I've had people say, well, he'll go to jail, but at least he'll have a roof over his head. But his disability shouldn't have to be criminalized for him to get services that he needs.
We're failing that individual in that situation too. Not only are we failing the family by not helping, it feels like we're failing that young man, her son.
We can do right by these people because this is the right thing to do. There is no gray area any longer. Something has to be done.
The challenge around this topic, we found, is getting everyone on board. While there's been progress, it's not clear yet if all the stakeholders in this system support this bill. A representative from the Minnesota County Attorneys Association tells me they are, quote, very interested in working with the legislature to address the gap cases, but declined to say more at this point. You can watch our original story, The Lost Souls, right now on KSTP.com.